The Executive Secretary, National Health Insurance Authority (NHIA), Professor Mohammed Sambo, says there are plans to distribute NHIA-branded drugs to healthcare facilities and also prescribe them to NHIA enrollees. Sambo said this in Abuja during the 17th edition of President Muhammadu Buhari's administration scorecard series, which featured the Minister of Health. He also spoke on the strength of health insurance in a growing economy like Nigeria.
What you gather is what will enable you to do actuarial determination of the service that you will deliver. So you realize that in a developing country, in a thriving economy, the kind of services that you will purchase will match the amount of the pool that you have gathered. Therefore, you cannot gather small amount of money and expect huge amount of services. We have to go with the level of our development as we are developing. There is going to be increase in physical space, there will be increase in economic growth, and there will be increase in salary of workers, and there will be more contribution in the health insurance fund. And that is how it will grow to a level that it will be able to cover everybody. The health insurance is more beneficial to the people that cannot afford. That is one cardinal principle, cross-subsidization. The resources of a rich is put in one basket, and the resources of poor is put in the same basket. And the risk of more vulnerable segment of the population are put in the same basket, and the risk of those that are less vulnerable is put in the same basket. So when you put those risks, according to epidemiological pattern of disease, occurrence of disease in the environment, it's not all of us that will have cesarean section. Of course, I cannot have a cesarean section, but she might have a cesarean section. But the money that is pooled from myself and from Dr. Garba will be used when she requires cesarean section. So that is one of the principles. So there is contribution according to your ability to pay, and there will be cross-subsidization so that those who are more vulnerable to having sick can benefit from the health insurance fund. Secondly, the ability of health insurance to deliver services is contingent about the amount of fund that is gathered. And how do you generate fund for the health insurance? It's from the salary, largely from the salary of the workers. I'm sure all of us, all those that are old enough to have been in Nigeria when PTF was being implemented, there used to be drugs that will see PTF inscription. So this is the kind of system that we are trying to put in place so that manufacturers of drugs in Nigeria, and they have agreed, and the Honorable Minister has approved the concept to go on. You have a drug that is going to be branded with NHIA branding. Manufacturers will be manufacturing these drugs. And once the drugs are done, it will be purchased and distributed to the healthcare facilities. And that's what is going to be prescribed for you. So that nobody will have cause to say that the drug that he is given is fake and substandard. And in the next few weeks, this system will be in place.